Hello, hello. Thank you for being here with us today. Let's just jump into it. So, our
Sure.
first question for you, can you please introduce yourself and also tell us a little bit about your personal and professional life?
Sure. My name is Dr. Deanne Simms. I'm a clinical health psychologist working here in Toronto, Ontario. Professionally, I am the clinical director for two provincial mental health services, and I'm also the president and CEO of a company called ThriveSpace Health and Wellness, centering around digital health interventions. Um, in my clinical work, I work with children, youth, and adults. And Personally, I am the proud mother of two very young, very effervescent, lovely children, and one fur baby. And I am someone who likes to, as much as possible, engage with friends, family, nature, and the arts.
Lovely, lovely. I was wondering if you can elaborate a little bit more about your recent, your company. I think it's Thrive Space, correct?
Yes. So ThriveSpace Health and Wellness is a digital health company that focuses on helping organizations or providers integrate technology into their services or to leverage technologies they already have to extend their reach and improve their outcomes. And I moved into this space after working in the public and private health sector for many years and really just becoming so aware of the barriers to access for health services and mental health services in particular. And I remember, coming away at the end of my work days just really feeling like there had to be more that we could do to help engage folks in healthcare and different treatments that they needed without having to rely on people driving for hours and paying for parking at a hospital and only coming within the daytime hours that my clinic was operating. And so really born out of some of that frustration was this focus on how to leverage technology to meet people's needs where they exist in the real world, in their communities and environments.
On that note, what has motivated you to volunteer at Ellie's Place?
It's that same piece of recognizing that for many people, specifically folks who are at this transitional age, um, you know, our systems just don't do enough in a lot of cases. And there are some ways in which people and their families and their loved ones fall through the cracks. And I've seen it working in this space with youth and young adults time and again. And I really think, I straddle the world of public health and private health. And I really think that no one space can achieve all of the needs of our really diverse population. And so we need to be creative. We need to be innovative. And Ellie's Place to me really is another key piece of the puzzle to help make sure that when people need help the most, they're able to access it.
To build on this whole notion of your experiences in Ellie's Place, do you see any opportunities in like incorporating essentially any of your learnings from your business and your experiences in this recovery model?
Absolutely. I think I have worked across the healthcare landscape from primary care to tertiary care, public, private, across the lifespan. And I've worked with really with this flexible mindset of how best to use science, evidence, and best practices to intersect with what the unique needs are for the individuals that I work for, that I work with, and that I design programs for. So I have that hands-on practical experience. I have the science-based grounding from my doctoral training, and then I have the system design and implementation skills that I bring to some of the provincial landscape in that space that I work in now. And so I think that with these three interrelated yet very different spaces or skill sets that I have, I think that I can contribute to some of the initiatives that we have underway and the real vision that we're driving for Ellie's Place and how that will look in the future.
I'm excited to see how it's all going to unravel, because definitely like very inspired by everything that you've been saying, and I think it's very interconnected with where Ellie's Place is going. So what would you like to add to this conversation around mental health?
I would like to add, or I would like to amplify some of the hope and some of the enthusiasm that I really see in the Ellie's Place team. There is this real sense of, we are going to get there. Hiccups might arise, different things might befall us, and yet we know that this is what we're working toward. We know that we will be able to offer this this really important, special place to people who need it. And I think the confidence and the energy is something that I certainly use to continue to drive forward. And I think that it's something that's integral to our work and something that I so deeply value as being part of this team.
Okay, so when we look at our tagline, where recovery grows, where does that lie in your life, and what does that mean to you?
I think that growth is self-perpetuating. I think to borrow from the enthusiasm, the innovation, and the encouragement of the Ellie's Place team, we're growing as individuals, growing as a group, growing as a society. And I think of the interconnected nature of organisms, really. Growth in one part of a system usually impacts growth in another part of a system. And I think that we're all progressing together with shared and unique pieces that we're using to build, to propel ourselves and our wants and needs and aspirations forward. And I think it is spreading. It's spreading to our communities. It's spreading to the world around us. And I think it's really inspiring.
For sure. And another question just came to mind too. I think this whole notion of stigma, with your experiences and your line of work and everything that kind of you've seen so far, where do you think that is going, and how can we do more to ensure that youth of today don't feel that stigma and are able to openly discuss whatever it is that they're facing?
I mean, what I see as a silver lining of a global pandemic, again, always looking for a reframe or a positive lens on things, is that we are now talking about population mental health. And so people who may not have historically felt the symptoms or experiences of low mood, of worry and anxiety, who might have felt that this was very foreign and, impacted people other than them, there is a deep cultural and global experience with the mental and physical consequences of isolation and of a global pandemic. And so I think that this is helping to normalize the humanity of mental and physical symptoms, experiences, and illnesses. And so I think it's an opportunity for people to say, oh, now I get it. Now I understand what this means and what it has felt like for people to have these experiences. And I think with normalization also comes some form of validation. So I get it. This makes sense for me. The extension is it makes sense for everyone else to feel this way too. And I'm hoping that that helps to decrease stigma and helps to decrease barriers when everyone can connect as human beings to say, oh, this is a real struggle, and what can we do to help ourselves and to help other people? And that may look different for different folks, but I'm really hoping that global touch point, that global experience helps to do away with some of that us versus them otherism that can sometimes happen and contribute to stigma within the mental health sphere.
Yeah, and I'm hearing exactly empathy versus sympathy, and there's so much power in being able to understand what somebody else goes through.
Yes.
As we work through this pandemic, even post-pandemic, coming out of it, maybe those conversations will look very different because of these experiences and this wake-up call almost right now.
Yeah.
But what a lovely discussion. Like, thank you so much for being here with us today. And I think Ellie's Place is definitely very, very lucky to have you on the team. Um, so thank you again for your time.
Thank you. Absolutely. Very glad to have been able to chat today.